All right, thank you, Brandon. As coronavirus cases rise, it is creating staggering challenges for doctors and nurses. At this hour, more than 1,100 Iowans are hospitalized with COVID-19, and resources and staff are stretched thin. KWWL's Daniel Perreault spoke with frontline nurses and takes us inside the fight against COVID-19.
Doctors and nurses on the front lines are exhausted mentally and physically. They say this latest surge in cases and hospitalizations is much worse than the spring. And with no end in sight, they worry about what the coming days and weeks could bring. They're scared. My words, our words can't do that justice, but theirs can.
It's hard to come into work some days knowing that you're short and knowing that you're going to see people die.
I've seen more people die in the last 7 days than I've talked to my own family members.
Prior to this pandemic, like me personally, I'll get attached to patients or I'll get emotional when somebody's not doing well, but it's different now than it used to be. You know, you go into nursing or you go into being a physician to help people, and it's draining when you can't.
Things were steady, and then all of a sudden, boom, we're seeing community members coming in. They can't breathe anymore, so they come into the hospital, and it just seems to be nonstop.
We're a lot better at treating at this time, but people are very, very sick.
I have a coworker who has worked the last 14 days. Multiple of us have worked, going on, like I'm going on day 7. So we pick up and then hopefully we get a small break.
We might have some open beds, but with the staff that we have available, sometimes we're close to our safe capacity for the number of staff that we have.
Fall into winter is our normal respiratory season. People, it gets icy, people falling, everyone's trying to get their surgeries before the end of the year. So just the added numbers of having the COVID patients just has been really hard to handle.
In the short term, this surge that we've seen this fall, we have prepared and we have volunteered and we have come in and worked extra shifts to get through this. So the thing is what's going to happen next?
We really are depending on people being responsible over Thanksgiving so that we don't have the surge like we did this last month, because we can't sustain that.
We're capable of taking care of people now, but if the spike continues to go up, at some point our capability will hit a cap, and we're not going to be able to accommodate everybody that needs care. And that's never a place that we want to be.
We can handle a lot, and we will stretch to accommodate the community. But if the community can do things to prevent more than we can handle, I think it's our collective responsibility to do that.
Our frontline heroes are pleading with us all to take this virus more seriously. They're begging us all to do the same thing we've been talking about for months. Wear a mask, wash your hands, watch your distance. In the studio, Daniel Perreault, News 7, KWWL.